Hi and welcome to our blood pressure assessment video. So we've got Ewan here as our client. We're going to assess blood pressure. Now blood pressure is defined as the force of the blood exerting itself against the walls of the arteries. Important to know that definitions. A client may ask you, what are you testing? What is blood pressure? So it's the force of the blood as it exerts itself against the walls of the arteries. We're going to use a stethoscope and a sphygmomanometer. Okay, this is a manual sphig. You can as easily use an electric one. These tend to be more accurate in the right hands. In the wrong hands, I'd probably opt for the electronic one. Now what I need to make sure Ewan's not doing is crossing his legs. That might just impact on the femoral artery in some way or form, so we'll keep the legs uncrossed. To position this cuff and the steth, what we're going to do is just get Ewan to place his arm out. We've already marked out the cubital fossa, which is just a shallow anatomical surface on his elbow, and I've drawn a cross there to highlight that we want the stethoscope drum to go medial and superior to that cubital fossa, so just there where I've made that mark. So how this works, I will place my steth in my ears, but I need to ensure that the ear pieces are facing forward because our ear canals do face forward like so. I've got a pump with a thumb screw. Okay, away from me tightens it, towards it loosens it. This is the cuff itself. I'm going to pop the steth, as I said, over that mark I've made just there. And I'm looking for about 2 finger tightness around it. I might just inform the client that this can expand and feel a little bit uncomfortable, just so he's expecting that. From there I've got the gauge here, the pressure gauge. Probably easiest if I just clip that onto the cuff itself so I can keep an eye on it. Now in my right hand I'm going to keep hold of the pump. I'm going to pump this up to anywhere between 180 and 200 millimeters of mercury. Once it gets to that point, I'll hear nothing. I'll hear complete silence. From then I'm going to loosen by turning the turning screw towards me, and I want to see a descension of about 2 to 3 millimeters of mercury every second. So a slow descension. So 2 to 3 of those small lines that you're going to see every second. Now what I'm listening out for are 2 sounds. From silence to the first lub sound, now that will be an audible lub, along with a needle afflection or a small movement of the needle. If it's just the needle itself moving, that's not an adequate amount of information, so we need to both hear the lub sounds and see the needle afflect as well. I'll gradually hear his heartbeat creeping in. Now that first audible sound is the systolic pressure, which is the pressure within the chambers of the heart as it's contracting and emptying. The needle will ascend down and then hit a point where I'll hear a beat or a dub, if you will, and then I'll hear complete silence. So that last beat before I hear nothing is his diastolic pressure. And the diastolic pressure, or the diastole, is the relaxation and filling of the atria and the ventriculi. Okay, so let's see how we go. What I might also do, because we are placing the steth over the brachial artery, I'll get Ewan just to make a fist with his right hand and just place that under his elbow, just to slightly hyperextend that elbow, just to bring the brachial artery with your fist, please, just to bring that to the surface. Just bring it to the surface so it's easier to hear. And the final thing before I begin, just the ranges we're looking for. The upper ranges for the systolic is not really above 140 or above, and the diastolic shouldn't be above 90. Either one of those are above those respective numbers, refer out obviously to a GP. heard the first sound come at about 110. Over 49, so wouldn't say it's quite hypotensive or low blood pressure, so I would write that down as about 110, maybe 111 over about 45, so it's pretty low. Do you normally have low blood pressure, Ewan?
Ever so slightly.
Yeah, so perfectly healthy. If it was accompanied by the symptoms such as dizziness, I might refer him, but if he was ultra low or ultra hypertensive, I'd be cautious of getting him from horizontal to vertical too quickly in certain exercises, just as his pressure wouldn't be able to equalise and he might get a bit lightheadedness. But other than that, I'm happy with that and we're good to go. That's blood pressure.